Hi, my name is Dana Arrington, and I am here to perform my skills lab for IV administration. So, first thing we're going to do is we're going to read off our MAR. I'm sanitizing my hands, and my patient is Miss Renee Adams. Her birthday is 5/25/1978. She has no known drug allergies. The medications we will be administering is cephalazine, sodium 1 gram IV piggyback to be given at 50 milliliters of normal saline over 30 minutes via gravity using 15 drops per ml tubing. Q 8 hours for urinary tract infection. So if you do the math, that's going to come out to 25 drops per minute. The second medication that we're going to give is sodium chloride, 500 milliliters to be administered continuously over 4 hours via gravity using 15 drops per ml tubing. Q 4 hours for hydration for 72 hours. So if you do the math, we're going to administer 31 drops per minute. So, now, I want to wash my hands. Now I have all my masks prepared right here. These are my IV fluids, my tubing, my alcohol pad. So now what I'm going to do is I'm going to put on gloves, and we are going to do our second MAR check. And what we're going to do is I'm going to compare my supplies to my MAR and also make sure there's no particles or the bag isn't compromised. And I'm also going to check the expiration date. So the first bag I have is the 50 ml bag of cephalazine, sodium 1 gram intravenous piggyback to be given at 50 ml over normal saline. 50 ml of normal saline over 30 minutes via gravity using 15 ml tubing. I have cephalazine, sodium 1 gram IV piggyback. Renee Adams, 5/25/1978. Renee Adams, 5/25/1978. The expiration date is February 24th, 2024. There is no particles free flying. The bag is not compromised. This is safe to administer. The next bag I have is the 500 ml of sodium chloride. I have 500 ml of sodium chloride right here for Miss Renee Adams. Date of birth 5/25/1978. Sodium chloride for Miss Renee Adams. Date of birth 5/25/1978 with the expiration date of June 24th, 2024. The bag is not compromised. There are no particles flying in, so it is safe to administer. So now that I check my bag against my MARs, I check my bags and things like that, we are going to go meet our patient, Miss Renee Adams. So, take it over here. I'm going to sanitize my hands. Hi, Miss Adams. How you doing? My name is Dana. I am here to administer your IV, your 500 ml of normal saline, and I'm also going to administer your antibiotics, okay? Is that okay with you? All right, great. So let me sanitize my hands. I'm going to put on some gloves. I'm going to have my MAR and my medication, and I'm going to check them against my patient's armband. So, can you verify your date of birth for me, Ms. Renee? Renee Adams, 5/25/1978, 5/25/1978, no known drug allergies, no known drug allergies. We have cephalazine, sodium 1 gram IV piggyback to be given at 50 milliliters of normal saline over 30 minutes via gravity using 15 drops per ml tubing. Q 8 hours for urinary tract infection. We're giving 25 drops per minute. All right, that's correct. The next bag I have is my sodium chloride, 500 ml to be administered continuously over 4 hours using gravity with 15 drops of ml tubing. And we are going to administer 31 drops Q4 for hydration for 72 hours. And the antibiotic, we are administering Q 8 hours for urinary tract infection. So now that I've verified my MAR against my patient, I'm going to wash my hands, sanitize my hands. And I am going to begin priming these bags. So the first bag I'm going to prime is the sodium chloride bag. Make sure my clamp is locked. Okay, bring this trash can over here. Squeeze my bag. And we are going to prime this line to make sure there are no air bubbles, particles. Okay, I'm going to prime this. Okay. Okay, it is nice and primed, no air bubbles. Okay, so now that I've primed my sodium chloride 500 ml bag, I'm going to take my gloves off, sanitize my hands, and I'm going to assess my patient's IV site prior to me setting the drip rate. So let me get my gloves. Ms. Renee, we're going to assess your IV site, okay? Have my alcohol swab. So I'm going to assess her IV site. I'm going to palpate it. No signs of swelling, no edema. It's not cool. There's no redness, no signs of infection, no signs of infiltration. Are you in any pain? Okay, good. The patient states she's not in any pain. So I'm going to clean the hub to her IV site vigorously for 15 seconds. Okay. I'm also going to clean the connector tubing of the normal filling. Okay, I'm going to connect my tubing to my patient. Okay, and our drip rate for the sodium chloride is going to be 31 drops per minute. So I'm going to time this for 31 drops per minute, starting now. 1, 2, 3, 4, 5, 6, 31. Okay. 1 minute. All right, let that run. Let that set for 31 drops per minute. Okay, so now she got her IVs rolling. So we are going to connect our antibiotic, which is our IVPB bag. So I'm going to change my gloves again. Sanitize my hands. Again, I'm checking her site. Are you okay, Ms. Renee? Any pain? No? Right, IV still patting it. All right, I'm going to quickly ramp this down. Now I'm going to prime my second bag. Now we're going to be mindful with priming this antibiotic because there are 50 mLs, and plus we don't want to waste the medication. So make sure my clamp is on. Spike my bag. Okay, break my bag. Okay. So you have to hang your piggyback higher than your primary bag. So I'm going to hang this up here. Okay. We're going to prime this. Slow it down. Don't waste the medication. Make sure you get all your bubbles out. Okay. Alright. Trace my tubing. Okay. Alright, we have this primed now. So I'm going to stick this here. I'm going to palpate and assess your site one more time, Miss Adams, okay? Sanitize my hands, put these gloves on. I'm going to assess our site one more time. Assess our site one more time. All right, no edema, no redness, it's palpatable, IV site is patented, no signs of infiltration or infection. Are you in any pain, Miss Adams? No? Okay. So now that we primed our tubing, I am going to connect my antibiotic to my first Y connector up here. Okay? I'm going to wipe this off vigorously for 15 seconds. Okay, I'm going to connect my tubing. Okay. Now, I have to time this for 25 drops per minute, okay? So let me unclamp all my tubing. All right, so starting now. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, so it's 19, 25. Okay, so we're going to let that flow. All right, and that is flowing. The drip rate is going. And what I'm going to do now is I'm going to sign off that I've administered the medication. I'm going to document that the IV was patented, the site is clean, dry, and intact, there are no signs and symptoms of infection or infiltration. I'm going to continue to monitor my patient for any adverse reactions, any systemic reactions,